Good evening, everyone. Good evening. All right, brilliant. Welcome to another episode of the Bus Chat. I hope you guys can hear me. If you can, all right, brilliant. I'm already seeing some thumbs up. Thank you very much. So we are going to be having another exciting time today, and what we are looking at is basically the impact of technology in the health and wellness industry. My name is Tommy Edwards, and I'm the CEO here of Tedbree and Tech1M. And what we do here at Tedbree, we are a software engineering and data marketing company, matching top talent with tech and marketing projects on our platform. And so we have the bus chat where we talk about the different impact technology is making within different industries. And today we'll be looking at the health and wellness industry. Now, I'm very, very excited to introduce my three fabulous guests that I have today, who are people that have touched the health and wellness industry one way or the other. And they will be sharing a lot more insight into how they feel that technology has actually impacted this industry. I will let them introduce themselves individually, but I'll call them out. And then you guys, as we call them out, remember what we do here on the bus chat. We typically will give them a very, very warm welcome with our emojis. We will be very nice and start to say lovely things about them within the chats. And then we will encourage them with a different clap and celebrate the emojis as they come on. So we have Oluwatimehin Ogunkoya, who is a medical doctor and a wellness specialist. Is going to give us his full bio because I believe that the best person to talk about, I'm probably the best person to talk about myself. So I'll allow him to speak about himself shortly. We also have the beautiful, don't you just love the glasses? It's just fantastic. We have the beautiful Aderonke Olusheye, who is a nutritionist and a health coach. And she's the founder and CEO of FD Natural. She'll be introducing herself as well. And we have the amazing Cliff Thomas, who is the CEO of the Institute of Business Transformation, and he will be introducing himself as well. So, the amazing thing about technology that we all know is the fact that it allows us to engage wherever we are. So, the four of us are here, but we are in different countries. So, I believe Cliff is currently speaking to us from Jamaica.
Yep.
Um, I don't know where Ronke is because I know she's not in Lagos today. She's somewhere else. And I don't know where um, Timei is as well. So it's probably in Nigeria. I'm in London. So this is the fantastic thing about technology. And our guests are joining us from different places as well. But then it keeps making an impact in different industries. So I think before I keep ranting and going on and on and on, I will allow each of my guests introduce themselves and tell us a bit about who they are and exactly what they do. And then we can start to throw in the questions and really dive deep on how technology has impacted the health and wellness industry. So let's do ladies first. Is everyone fine with that?
I was, ho- I was
Absolutely.
hoping you were not going to do that.
So let's do no. I know we're going to do ladies first, and I'm going to pin Adaron Ket to the stage to talk to us about her fantastic business.
All right. Good evening, everyone. I hope my voice is loud and clear. I hope you can hear me. Okay, great. I can see the hearts. Okay, my name is Adirunke Olusheye. My community, they call me Dibia. Now, Dibia is, if you are from Nigeria and you're from the eastern part of Nigeria, they call their herbalist Dibia, right? So my people call me Dibia. That is my own brand name for what I do, right? That's it, like a personal brand name. I'm a holistic health coach. I'm a certified nutrition and health coach. I'm also a certified holistic health practitioner. I'm a naturopath. I'm a nutrition scientist. I'm a master herbalist, and I am a certified aromatherapist, right? And I am the founder of FD Naturals. And basically, what we do at FD Naturals is to inspire wholeness. We do this, via our teachings, helping people to heal with nature. Basically, we use food and herbs and essential oils. That forms the base of what we do at FD Naturals. My journey started in 2016 after an unfortunate but life-changing experience, right? And it was this experience that made me to see, the greater need in the health sector. And it's interesting that my father wanted me to be a medical doctor, but I said no because I can't stand the sight of blood, right? But I mean, here I am, God knows how many years later, and basically I am helping people, to heal. So in a nutshell, what I do basically is that I inspire wholeness with everyday lifestyle habits. That is what I do, and that's basically what we do at FD Naturals. And we've been able to help thousands of people, male, female, children, since inception in 2016. So it's been 6 years of doing what I do, and it's really been an amazing journey. Like, I wonder, why didn't I start this much earlier in my life? So it's really been an interesting journey for me, and I know that it's going to continue that way for a long time to come. Thank you.
Oh, wow. Thank you. Thank you. Thank you so much. I like the fact that your dad wanted you to be a medical doctor and then you can sign the sight of blood. Now you find yourself in the health industry. And once people say health, the first thing they think about is medical. And then you've gone to a completely different side of it, which is
Exactly.
calling yourself an herbalist. And I'm like, okay, we're going to dive deep on that. And I'm sure that people will have questions and different things for you. So thank you so much, Ronke, for being here today. And I'm sure we'll get to speak very, very soon, as we can't wait to hear all about the fantastic things you guys are doing at FT Naturals, and especially how technology is helping you achieve the things that you're doing.
Sure.
So let's do a mini, mini, money more. So I think I think we'll go to Timai next. So Timai, please talk to us about what you do at Total Health Trust, and thanks for being here.
All right. So thank you so much for having me, Tommy. I must say that I'm absolutely delighted to be on the platform and to have this conversation. I, for one, like to have conversations of this nature so that we're able to push the embers of the things that are possible and achievable when it comes to health. As an introduction, I'm Oluwatimileyin Ogunkoya. I'm a medical doctor by training, a health enthusiast, and a wellness specialist. And what I do with Total Health Trust is that I lead the team, or the wellness team. And what we simply do, and what we have been fortunate to be able to do over the years, is to basically design, implement, monitor, and evaluate wellness strategies for organizations. So for multinationals, for corporates, for SMEs, what we do basically is to put together wellness initiatives that helps to cater to the needs of the employees of the organization in such a way that we're able to optimize the well-being of the individuals as well as increase the productivity as well. So for us, it's a win-win situation. And one of the things that is very dear to my heart is that when it comes to health, and this has already come up in the conversation already, sometimes we're quick to think about diseases. So we're quick to think about ailments and things along that line. But for us, at the heart of what we do is ensuring that we have a thorough understanding of what health really is. So in defining that properly, it's a complete state of well-being, both physical, mental, and social, and not just the absence of a disease. So at the heart of everything we do at Total Health Trust is to make people healthier. And we like to say that we make Nigerians healthier. And that has to do with us being able to push and put together these wellness initiatives that helps to optimize well-being. And so I'm absolutely looking forward to an insightful conversation as well.
Fantastic, fantastic. So not only do we have an herbalist in the house, we also have a medical doctor in the house. I wonder what next we're going to get. Thank you so much for being here, Oluwatimileyin. Timileyin, and I'm sure that we'll be able to have even more and more interesting conversation. I absolutely believe what you said when you said that, when people just hear medicine, the first thing they think about is diseases, and we need to think more about daily habits. And both of you, both Ronke and yourself, just mentioned about the daily habits, and how we need to be conscious. I know you haven't said that, but I can tell where this is going. And I can't wait for us to really dive into those conversations. So the last but not the least, I will like Cliff Thomas to come to the stage as well and introduce himself and what he does.
Hey, how are we doing, everybody? My name is Cliff Thomas. I'm the CEO of the Institute of Business Transformation. I've been in the consultancy industry for over 26 years, which means that I must have been, about 4 when I started. So you guys will work out the maths. We have offices based in Accra, in Ghana, and also in London. We have a mission that pretty much summarizes what we do. It's to unleash the entrepreneurial giant in the African population, especially the youth, creating a platform for them to build generational businesses, which is so important for us. We also want to elevate the level of efficiency, productivity, and profitability through an ecosystemic, transformational, educational, and consultancy solution. That's a mouthful. So in summary, as a company, we're focused on providing consultancy services, especially within the digital transformation sector, to many businesses of varying sectors. That includes health and well-being. And we're also focused on providing educational products to many that target many people, especially the development of entrepreneurs. So that's me in summary. So back to you, Tommy.
All right. Interesting. I got a lot of wow, 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 wow. I can't wait to hear the wows. Please put. Can you ask your questions in the Q&A area so we could understand the definition of the wows? And I think yes, like you said, it was a mouthful in terms of what you do at Institute of Business and Transformation. And I like the fact that you're looking to make a significant impact in Africa, but you've not always started as a consultant within you've not always just been a consultancy service. I believe that your journey, and this is me knowing you, your journey started a little bit within the health industry as well. You've touched there somewhere. Do you want to just give us a little about what you do within the health industry or how that has come about?
Absolutely. So as a consultant, I've had the privilege of working for many organizations in different sectors. A major organization I worked for, especially in London or worked with, was the Institute of Wellbeing. That's an organization in London who are also venturing out into Africa. And their focus, they were supported or funded by the Department of Education. And they provide a lot of consultancy wellness services, especially within the mental health sector, counselling sector, etc., to people of the ethnic minorities. So my work with them was looking at how we would create digital technology to access various people within the hard-to-reach areas who couldn't access consultants within their local regions, etc. And I've also worked with organizations in the food sector who produce products that's focused on helping people to start to think about the products that we consume into our bodies. So an organization that I work with looking at cookware products, and they're focused on ensuring that we have only certain metals used that reduce into toxins when certain cookware products are actually heated, and as a result of that, it reduces the effects of leaching of the chemicals that make up the cookware. And so as a result of that, it forces people to not utilize oil when cooking, forces people to cook products at a reduced temperature that allows the maximization of nutrition, etc. So that's kind of like the area that I've consulted with regarding health and wellness.
All right, interesting, interesting. So I just wanted to touch on that because I knew that's something that you have. As we started with a very consultancy, and I wanted to bring out the health part of it. And so thank you so much, everyone, for introducing yourself and to let us know exactly what you do. And I think this is where I'll throw the question out, the very first question that I think, and any one of you can take it. How do you think, and let's just go straight to the point. How do you think that technology has helped in enhancing the health and wellness industry so far? And then someone else can take the where do you think is going? Where do you think is going next? As I believe that, with the things that we are seeing, with the gadgets and things that we are wearing, there is so much. Everyone is beginning to think about, okay, how do I look? Is it just all about? Are we trying to do how do I look from a beauty perspective? Or are we also trying to feel how do I look from a health conscious perspective? What's your take on it? Do you want me to pin it down to somebody? Someone needs
I
to.
think it would be better if you
Okay, so I would like to hear what Oluwatimileyin has to say on this. And it's frozen.
All right. So thank you so much, Tommy. And I think it's a fantastic place to start in terms of having the conversations about exactly the impact that we're seeing that technology is having on the health and the wellness space. And if we put it quite simply in such a way that is easily consumed, is to say that it's making things better. And that for me is the simplest way to approach the conversation, is that what tech is doing with the health space, as with every other space as well, is making things better. So what you have from a practical standpoint is that individuals having access, readily, easily access to healthcare. And that obviously, just turns the table completely around. And so what you had before, wherein individuals literally had to walk into the hospital to get access to care and all of that, you have that distilled into, their phones, with things such as telemedicine and all of that. And so without pushing too much and saying too much, and so that I ensure that I leave a lot more for the other panelists to say, is to say, number one, it's making it better. Number two, it's making access better. So in that regard, what it means is that we're bringing healthcare to the doorsteps of individuals via the mechanism of technology. What I would also just like to quickly add to that is, I personally believe that the picture that we're looking at in terms of the future is to get to a point wherein an individual's journey when it comes to their health, both where they have been, where they are, and where they're going to get to, is woven together. And so for me, what we're seeing is that we're seeing pockets of advancement in terms of technology. So we're seeing things such as what Runke most likely is doing from a nutritional standpoint. We're seeing people do things from a physical and exercise standpoint and all of that. But what we need to start thinking about is to find ways to integrate all of this such that in one platform, on one pedestal, an individual's health journey is woven together. And that pretty much for me is the future of the marriage, so to speak, between technology and health.
So I won't let you go that easily. So you said something that marries together. So if you're saying you want us to see something that marries together, what would that be? Would it be, don't let me put words into your mouth. What are the models that you think needs to stand together to make for a holistic kind of platform that allows what you are, the future that you're envisaging have to happen?
All right. So thank you for asking, because it's important that there's absolute clarity to what exactly it is that I'm saying. So what you would agree with me is that what we have today is that, for example, an individual perhaps can have on their phones multiple apps that do so many different things. So I have an app that helps me to exercise. I have an app that helps me to pay attention to my diet. I have an app that, maybe helps me access a doctor via telemedicine and all of that. But what I'm saying is that if we're really going to maximize what technology helps us to do and be holistic in our approach, we need to find ways to integrate all of this together, have it woven together, so that when you're having a conversation with a doctor on your telemedicine platform, he has insight into what's happening in terms of your exercise routine. He has access into what your diet is like. He has access into what your medical records are. So whilst we're having all of those pockets of advancement, what we really need to start thinking about is how to integrate all of this in such a way that the holistic approach is given to our health. Because like I said, health is not just about the absence of a disease. It's a complete state of well-being. It's physical, it's mental, it's social, and there are so many different elements that must come together if we're going to be able to maximize and optimize the well-being of the individual.
I absolutely agree. I think that the challenges to think of when it comes to a system like that is in terms of every country seems to have its own healthcare
Yeah.
system. And it's then how do we, if we are going to push this forward to actually make this sort of future happen, how does the NHS in the UK cross over with the health system in the US? But also we cross borders, don't we? So what happens if someone in London that has this, everything about them is just with the NHS here? What then happens if they go to Nigeria? They have absolutely nothing. They don't know anything about this person's record. So should there then be a way in which we have to develop individual healthcare system with these technologies to then integrate with it? Oh my God, that is going to be an interesting future. And I don't even know who can take on a project, but I see where it is and I see the benefit of what you're talking about. Let's see somebody else's view on this. Who should I just pin somebody down? Keith, I heard you say something.
Yeah, I love what you just shared there in terms of having a system whereby if you go to Nigeria, or you go to Jamaica, or you go to the UK, etc., all of that information is within one place. But for me, that information needs to stay with the individual and goes with the individual. So, for example, one of the things that you said earlier was regarding medicine. It's become reactive, but I think we have an opportunity of it becoming preemptive. So, for example, if I have all of my records within my app that speaks about all of my metrics, it speaks about all of the medication that I'm taking as an individual. It also speaks about or gives me education regarding my ailments. Then one, as I travel, the doctor in that country can have access to that same records because it stays within me, not within a healthcare system. Two, through education, I'll be able to understand and make decisions myself and look at alternative medicines that I may wish to try, as opposed to relying on one specific form of medicine that's provided by the country that I reside in. So I like the idea of having the shared information stay within the individual, and that information goes with the individual as they travel or they reside, etc. Various countries.
Speaking, yeah, fantastic. I totally agree. Maybe that's the way. It stays with the individual as they travel, but then how does that communicate with? So there needs to then be a way in which people can, regardless of what country you're in, they can understand what you're carrying, and so it's now like a transmitter that basically explains exactly what you. I don't know. You guys are living in a in a world I would love to be a part of, and we're already thinking what could happen in the future. But I get you. That is where it's going. And
Well, we have our social media history within a particular cloud, don't we? You know, you have all my photographs and all your bits and pieces. So why not have our medical records there? So it's in one central place that is non-domicile. It's in a particular place whereby my doctor, given permission by me, a doctor can have access to all my records and see my lifestyle choices and various things that I've been involved in, etc. And as a result of that, know my full history and prescribe the right treatment for myself, for example.
Yeah. I see where your head is, and I think that that is a very, very good argument. But then we could then have the whole privacy issue, and there is the security issue, and so many other things too that goes underneath that we need to discuss. But it's a very, very good first step, and I'm liking where this conversation is going, more technology driven, which is amazing. So okay, I'm just thinking, do you want to add to this as well, or do I just come up with let's go straight into the police note? Or you okay?
Yes, I have something to say regarding that. And I think I would want to come from, I mean, we've been talking from the perspective of, people, the recipient. I think I want to talk from the perspective of the providers, people like us. You understand, people like the NHS and all of that. And I can 100% say that if not for technology, someone like me will not be here today. And that's the honest truth, because I am naturally a very shy person. And the only way I knew, to market things or to tell people about things was the traditional way of marketing, which was walking up to people, telling them this is what I do or this is what I have to offer. Trust me, if that was the way, I wouldn't do it. Because I mean, growing up, I had a problem, with dealing with rejection. So I don't like people telling me no, right? But I am here today because I harnessed technology, right? Now, today, I speak to several thousands of people without knowing who they are, and they listen. And I am sure that there are whole lot more, other people like me who cannot stand up. Of course, I've gotten better by the day, by the years. I mean, now I have conquered my shyness and I can talk to, anybody that I want to talk to. But if not for technology, I wouldn't be here today. And there are a whole lot of people like that. I remember when I started when I started FD Naturals, and I got to a point where I was having a whole lot more people come to me, and they were like, "Oh, we need to book a session with you." It was it was a Herculean task, having to manually give out, session times to people. It was draining me. It was making me literally mad. Like, you give people but I remember that was one of the reasons. I mean, that was one of the reasons how I met Tedbree. And it was like, since you guys took over, I mean, I've had like people work on my website, but it just wasn't what I wanted until I met you guys. And since then, I am a tech, not so tech person, right? I have always loved, anything that has to do with tech, but I guess along the line that love fizzled out. So I am the kind of person that checks my Google Analytics like every month. I'm trying to find out how I am doing, the traffic on my website, are people visiting, and all of that. And one day I remember I sat down and I said to myself, here I am sleeping. As in, I go to sleep, I wake up in the morning, and then I realized that people have made use of my website to book sessions, to get products, without me necessarily, going out of my bedroom. And honestly, we've not even scraped, we've not even touched the tip of the iceberg when it comes to marrying, when it comes to the impact that technology is going to have on the wellness industry. Timileyin was saying something earlier, and when he was saying it, I was reminded again of one of my, I mean, like, I hope to see it in my lifetime, where people like us and the medical doctors can come together and form a synergy. And I think it is only technology that can make that happen, right? People in the developed countries, you guys, I mean, we say that you guys have everything working for you, I mean, seemingly. But in developing countries like Nigeria, we still need to go to the people, because a lot of them are still held back, like, oh, this is the way we've known to do things. And they are yet to embrace the ease that technology has to offer to them. So we need to bring that technology home. We need to bring it home. And I know what I'm saying. I'm saying it from a perspective of someone, who has people, who talks to people every day. And it's amazing that, you see, people in developing countries, when we get to developed countries like UK, US, we find it as in we don't think twice. We go to websites, we make use of technology to get things done. But when we come home, we think it is too much to deal with. We think that, why are you sending me to this place to go and do this when I can just talk to you, right? So I think we still need to bring this technology matter. We still need to bring it down to what I would call the grassroots. We are getting better. We are not where we were years back, right? But we still need to drive it home, because until we do that, that may just be a stumbling block to this marriage that we are talking about. But like I said, we haven't even seen the tip of the iceberg when it comes to what technology can do in the wellness industry. Today, people can harness, health and wellness services and wellness solutions without leaving their homes. I mean, COVID-19 came to teach us that. We
Yeah.
don't need to leave the comfort of our home to get things done. And the only way that could have happened was because technology was present. You understand? So I think that it's very wide. I think that it is something that in the nearest future, whether we like it or not, we would have to embrace it. But in the bid to do that, we need to educate people, especially in the developing countries, right? So that when this time or when this change comes, it is received without, any hassles.
Fantastic, fantastic. I totally agree with you. And like you said, it's especially for millennials and for so many other people that you are a bit tech savvy. Sometimes we tend to forget that not every single person is. And some people might find this a little bit challenging. How do we make sure that what we are saying doesn't go to deaf ears? It's not all about segregating people and saying, all right, you need to do this yourself. No, we need to carry everybody along. As if tech is the future and it's transforming different environment, different industries, then we need to figure out how do we teach that technology to the grassroots? How do we make it so simple that anybody can understand
Exactly.
it? I think that's exactly what you're touching on. So before we go, we were already started having some questions. Before we go into those questions, I wanted to remind our the people that have made time today to be able to be here. We have what we call the leaderboard. And so, and if you've been here before, you know that you get to win some fabulous gifts if you partake on this exercise with us. But the more chairs you make, the more questions you ask, the more comments you make, you climb up the leaderboard. So today I can see Faith Adiola is the queen here. If she ends up being the queen at the end of our chat today, she gets to win 50 pounds. 50 pounds, and whatever wherever she is will be converted and sent to her. So don't let Faith Adiola take this away. I can see Ibrahim Olusegun is just 5 points behind Adiola. So do whatever you can do to overtake her so that you can be the king. All right, so interesting. You start to see the battle happen within the chats and lots of thumbs up, even when you're not saying what you need to say. Okay. Now we have an interesting question, and I think it's something that you were just touching on, but I think we can allow other people answer this. This is from, I'll put this on stage. This is from Angela. She's saying integrating everything into one app, like Oluwatimeya said, wouldn't that be overwhelming, especially for individuals who aren't tech savvy, just as Adorunke has mentioned? I think the obvious answer to that is definitely yes, but I don't know. Is there anything we could do to make it less overwhelming? I think that's probably the next appropriate question.
Awesome, awesome. If I may, Tommy, can I just jump on that?
Yes, please.
All right. Thank you so much for asking, Angela. And I'm particularly delighted that we're able to push this conversation to the next level. So while Shoroka was speaking, an example readily popped up in my mind. And I'm just going to try to give that to buttress some of what she has said, because it's very valid that we understand that the technological solutions that are developed must also be practically applicable at every level. It's not enough to have a fantastic solution and we're all excited about it. Its usability is very important. And I'll give you a classic example. So when the pandemic hit, a lot of the conversation within the country was about telemedicine. So we talked a lot about it, that since individuals cannot leave their homes, there's the need for telemedicine and all of that. Now, mind you, globally, the utilization rates for telemedicine is usually somewhere in single digits. So it's somewhere around 4%, 8%, and all of that. So it means that its uptake is still growing. However, locally in Nigeria, what you would find is that it's even below 1%. So a vast majority of individuals within this climb, we still have the traditional behavior of wanting to walk into a hospital to physically see a doctor. And so whilst there was a lot of clamor about using telemedicine, one of the things that we observed within the organization that I serve in is that the uptake was quite slow. So what we did was that whilst we were offering telemedicine as a solution, we also created something that was available on WhatsApp. And it was such a fantastic revelation, so to speak, that we were finding utilizations and uptakes that were 10 times what was available on telemedicine. So here we had the telemedicine solution wherein individuals could talk to a doctor and all of that, and a lot of people weren't using it. But the moment we created something on WhatsApp that individuals could literally use, the uptake went through the roof. So what we found out was it's not enough to just have a grand, amazing solution. How practical is that solution? How usable is it for the individual? So whilst I'm talking the need to integrate and all of that, it's not enough to create a solution that integrates everything. We need to find practical ways to do it in such a way that individuals are able to use it and it doesn't have a downside in terms of how it impacts the individual. Because the honest truth is the future that we're looking at, you would need to bring things together. You would need to do it in such a way that whatever it is you are doing, your managing physician, your doctors, your nutritionist would want to see all the pockets of data that tie into your health state. And so we need to find a way to continue to look holistically, but at the same time, it has to be practical. It has to be in such a way that individuals at every level can actually use that solution.
Absolutely, I totally agree. So when the example you gave on the WhatsApp, this is the find the users exactly where they are, go and meet the users where they are, use adaptable things that they're already used to, and drive them into this whole technology thing very, very slowly. I know that it wasn't overnight that people knew how to use WhatsApp, but WhatsApp was clever because it just seemed like the normal way. You already know how to send a text message. Now send it in, just sending that text message, just using a different sort of application. And so people could get their head around that is only a place to send messages. As soon as you add other things into it, it starts to become a whole lot more. So I think the smart thing that you guys did, now taking it onto WhatsApp in a place where they already know how to use it, is a smart way of using existing technologies that people are already used to drive the advancement of what these new technologies that are coming and getting people into it slowly, slowly till we get to where we really want to get to. Thank you so much. So, wow, quite a few questions. I don't even, oh my God. Right. We have another question here that I'm going to bring on stage. And I think this will be for you, Cliff. How can we improve technology on the health and well-being of people at the grassroots level? Everyone is saying the same thing. We are all talking about this conversation. Are you happy to take this?
Absolutely. I think I'm just leading on from what the doctor spoke about in terms of we've really got to think about the age demographics of the people that we're trying to help. So by utilizing existing systems, I mean, my mother uses WhatsApp. She's very comfortable with it. And she feels like, wow, I can use WhatsApp. I understand technology. So by utilizing what's out there, I think is important. But what we also need to do is that we also need to think about it coming from the earliest form of education. So be it within schools at the very, very, very youngest level, that we're starting to speak to people about the awareness of health and wellness and really starting to bring that into our curriculums, really start to get people to understand not just this is a food that you should eat, this is why you should utilize sugar or reduce the effects of sugar, but really showing them from a medical perspective, showing them from a lifestyle perspective, a lifestyle disease perspective, etc., but really showing them through an educational perspective that this is why you should do it. And I don't think that we do that enough. And I think that will help affect the grassroots as we're bringing people up through education, in my opinion.
Okay, thanks for that. I totally agree with you as well. Those are some of the ways in which we could affect and impact the grassroots and creating grassroots solutions that could impact the conversation that we are having today. There is this particular question that's been upvoted 4 times, so we want to run through these questions. So And this is from Faith Adiola. She said, does technology have any negative impact in the health and wellness industry? This is an important question that I think, in as much as technology can do good, it can do a whole lot of bad. And it's about what are the negative parts of technology that we need to start considering. Who wants to go for this first?
Yeah, I think I would love to take this. The answer is yes. There are negative parts because that's one of the things that I do in my practice, because I know that we basically live in a world where we cannot do without technology. I mean, if not for technology, how can we be having this conversation? So there are the good sides and there are the bad sides, the negative sides. So if what I tell people is this: you need to find that balance, right? You need to find that balance. For instance, one of the adverse effects of technology on our health these days, and this affects not just adults, but we're also looking at kids, and I see this a lot all the time: vision problems. Why?
Yeah.
Because we stay glued to our screens all of the time. Like the average child today wakes up in the morning, is with a gadget, stares at the gadget, they go to school, they're doing, especially during the pandemic, it just took a skydive. They are learning with gadgets. Now, while it is good, we can't say don't go to school. There is a pandemic. They have to continue learning. The question is, what are we doing behind the scene to make sure that this negative impact of technology does not impact on their health? These are the questions. If we, like I always tell people, if we ask ourselves, very salient questions, it will prompt us in the right direction as to what to do, about those things, because we cannot live without them. So while there are the negative effects, I say there are solutions. So for instance, there are things that we call screen guards, right? A lot of us have phones and there is this blue light filter on our phones. A lot of us don't use it. There is a reason why it is there, but nobody is using it. And then at the end of the day, we start saying that we're having eye issues, right? I mean, you guys can see me among glasses, right? I can do without my glasses and have this conversation. But most of the time when I'm with my screen, I use my glasses to protect me from the rays that are coming from my devices. That's one of the major reasons I can actually do without. I can drive without them and all of that. But because I know I've been battling, vision problems practically since when I was in my junior secondary school days, right? And I kid you not, until I had a change of lifestyle, until I had a change in my lifestyle habits, nothing about my vision changed. It was getting worse. Now I go for my checkup and they're telling me that, the thickness or the strength of my lenses needs to reduce. Why? Because I noticed a pattern and then I flipped it around by just making certain changes. I converse with my clients every day on my phone. I need it. We need technology. But in doing that, we must always think of the things that we can do to negate, whatever side effects that may be coming from it. So yes, technology can affect our health and our wellness in a negative way, but we can actually curb it. It is a choice. So for instance, I tell my clients that are dealing with, inability to sleep, I tell them, drop your gadgets. Once it is 7 p.m., max 8 p.m., drop your gadget, because the longer you stay with them, the more difficult you're going to find to sleep at night, right? So these are some of the measures that we can put in place. There are solutions. We just need to put them in place.
Wow, you touched on a lot of points. Everyone starts to feel. I could see the chat, and everyone's like, "We sleep with our gadgets. We can't do with them." You can
You sleep with a gadget.
when your phone is about to die and you have 2% and you're literally shaking. Like I need a charger. I need a charger. So it's an addiction, and I don't know where it's going. But the things that you're talking about, we need to hear more about it. How can we still use this technology, but use them in a smarter way so it doesn't affect our health in a negative way. And I think that's a
Exactly.
completely different conversation that we need to have often.
Totally different. What do you hear?
Yeah, and especially for the very, very young ones.
Yeah.
Oh my God, it's like you're trying to take an iPad from a kid. It's as if you're about to kill them, and you're no,
Honest.
keep the iPad to me, and you're still like fighting over that. So we need to catch them young and have the sort of conversations that you're talking about. So thank you so much. That's an amazing, amazing one. Wow, these questions are rolling in, and we don't have enough time. This is going to be a very, very quick one. Who is going to go for this? It's saying we've been talking about solutions. Are the solutions cost effective? And this has been upvoted 5 times. So people want to know that the cost of, we could say before all this or advanced technology came about, you could walk to your doctor and you tell them, yes, but then the price you are paying is not money, but the price you are paying is you are losing a lot of time and you are losing, some things were not accurate. And I think
Yeah.
a better way for me to look at this question, are the solutions cost effective? I think it's all about pros and cons for me. And I think the
Exactly.
pros outweighs the cons when you look at that. I don't know what's your
Yeah.
take on it.
Yeah, I agree with you, Tommy, that when we talk about the cost effectiveness, we're not only talking about the financial ramifications of it, but as you said, we're talking about long-term health impact, we're talking about time saving, we're talking about education and awareness, we're talking about instant accessibility, etc. So from a cost-effective perspective, if technology is going to help to improve the health and well-being and awareness, then in my opinion, it's cost-effective on so many levels.
Yeah, I'm inclined to definitely agree with that. So we have a few more questions, and I'm looking at the time. We have 9 minutes to finish, so I'm rushing. But that being said, let's take a look at our leaderboard and see what's going. Oh my God, Faith Adiola is on fire. She's still holding up the top at 4:55, and Shegun is behind at 4:20. The next number 3 and 4, you guys have been dusted. It's a game of 2 people. So let's see who takes it at the end of the day. So let's go to another question, and this is from Amarachi Victor. I'll put that on stage. So she's saying there's an ideology that the health industry rarely engage in marketing or adverts. How true is that? And how has technology helped in that area? So is that true?
Yes, it is true and it is not true. Yeah, it is true because yeah, traditionally the health sector do not, engage in, adverts and marketing. And I think it is because they are overwhelmed already as it is, not because they don't want to. Not already they are go to a typical hospital. At least I can speak for Nigeria. You go to a typical hospital, one doctor to God knows how many patients. So they don't even have the time to attend properly. You understand? To those patients. And then you want them to go and do adverts. Adverts are supposed to bring you more clients, right? So when they bring in more clients, who exactly is going to attend to them? The manpower is not there, right? But again, on the flip side, I think that, especially for companies in the wellness industry that are not about, treating diseases. You understand? Companies that are about wellness, about prevention, they are actually going out. I mean, they're going out of their way to make their voices heard. And I think the social media space is really, really helping with that. Right. So you see a lot of these organizations on Instagram doing sponsored ads, on Facebook doing sponsored ads. But when you look at them critically, they are more about the preventive lifestyle. So companies in that category, in that health sector category, are actually pushing themselves out there. But you see, for those, I mean, like hospitals, they don't have the manpower. So it will literally be like a waste of, of resources to go out there, tell people to come to you. And when they come to you, you don't have what it takes to attend to them, because already by default they are overwhelmed. They are.
So
see
I,
our
So I
I
think
can,
I see our
I
doctor
just
laughing.
add to that, if
yeah,
it's okay
exactly.
to.
I wanted to
Um,
get your
I
perspective.
can see him laughing during that, overwhelmness.
So I also saw a chat, a comment in the chat box where Victor says, "Oh, more clients will equate to more
Yeah.
money," and all of that, which is quite interesting. So let me also just put it in perspective. So a sizable chunk of that knowledge and that understanding that had been prevalent had to do with what is obtainable from an ethical standpoint. So the core reason why you would find that some professionals, and this is not just limited to the medical space, some other professionals as well, withdraw from putting what they do out there from an ethical standpoint, because what you don't want to do is to put out the wrong information or try to lure people, so to speak, into what it is that you are offering and all of that. So the real reason why that notion was birthed was from an ethical standpoint, is to limit the amount of information that is being put out there in terms of trying to get people, to engage with that particular medical service and all of that. But having said that, and thankfully, Ronke also mentioned this, that a lot of the dynamics are changing. So nowadays, what you're finding is that individuals within the health space, within the wellness space, are engaging a lot more with not traditional media this time around, with what you would call digital media in that space. And the reason why that is happening is this, and I firmly believe this, that when we talk health and wellness, it starts with access to adequate and accurate information. And Cliff has also added this and weighed in on this, that it really has to start with information. People have to be better informed. They need to know exactly what they need to do. And that's why you find that nowadays people in that space are putting out information. So you're even having health influencers, which is something that perhaps 20 years ago would have sounded absurd. But you're having people pushing out that information because everyone needs to get access to adequate and as well as accurate information when it comes to their health.
Fantastic. So we have 2 questions and we won't take any more. Guys, I'm sorry, we're running out of time. And we're going to answer these 2 questions. This one, I'll give this one to, let's put this on stage. So this is from Abiodun Oluwatoyin Mary. She's an entrepreneur and she's in Lagos, Nigeria. She said, how can we encourage small business owners who wish to explore in the world of technology but cannot afford it? Cliff, from a consultancy perspective, how do you go about this?
I think a lot of people, technology is in essence expensive. Okay, if we utilize existing systems that may be out there, or if we understand how to maximize the use of technology, sharing best practices between like-minded businesses, etc. It becomes expensive when many business owners don't have the full awareness of the benefits that technology could bring to them. They're often misguided sometimes by information that's out there on the internet, or by a consultancy service that may offer certain solutions that they just don't need. So my thing is, look at the problem that you're trying to address, and look at what if there are organizations out there that solve the problems within themselves. Look at the information that's available via the internet, because you can ask the internet any question to find a solution. And if not, find the right consultant.
Absolutely. You know where to go. And so with these 2 questions, this final question, I will let Ronke and Timilani take this. And it's very similar to what you've just taken, Cliff. What would you say? So this is from Angela Oladipupo. She's a content strategist at Tedbree. So I don't know her, but I know her. What would you say to small business owners who feel that tech isn't really a priority, considering it seems expensive to them? And I think it's pretty much a play on the last question.
Yes, it is. Okay, so this is what I would like to say. And I'm saying this because I'm no longer a small business, right? By reason of how, we are categorized. But I started that way. I started business from a one room in my 2-bedroom apartment. So I understand where this person is coming from. And this is what I would like to tell you. Expensive is relative. And just like Cliff just said, there are certain tools that are available that you probably don't even need to pay for yet. You understand that you can harness and use to drive your business. Another thing you can do is you scale up in business. You don't go from a kiosk, to owning a building in one day. No, there is a process. So what I would like to tell you is follow your process. Depending on where you are, find the technology that suits your business and that can work with your business. When you outgrow it, because really that is what business does. When you outgrow certain things. When you outgrow them, you know it is time for the next level, right? There was a time I was engaging website developers in Nigeria, and what they were giving me seemed to be okay. It got to a point I knew that it was no longer okay. What did I do? I started looking for someone who can give me something better, and I met Tedbree. You understand what I'm saying? So I moved from a 1-bedroom to owning a very small office. Then I moved from there to a 2-bedroom office. Now I am in a 5-bedroom duplex. Processes. You don't just get there in one day. And I like to tell business owners, remove that word expensive, because when you compare it at the end of the day, the stress and the time that you waste, you cannot compare it to that amount that you are going to pay. Trust me, I know where I'm coming from, and I can tell you this wholeheartedly. You cannot compare the stress to the amount that you are going to pay. So, like I said, just start with the basics. Start with the basics. Free tools, there are plenty all over the internet. Start with those ones. You will make money from those ones. Trust me. You will make enough money from those ones to be able to scale up, to be able to afford, maybe much more intensive technology that you need. And when you get to that point, you'll find out that you just move into it. Like it's like a moving vehicle. You just keep moving. As long as there is fuel in that vehicle, it will take you to your destination. So that's what I have to say. So maybe Tiffany can.
Yeah. So just before Timina speaks, I wanted to comment on something that Ronke mentioned. I remember my first meeting with Ronke herself, and this was just when she was exactly what she's describing right now. And it was at the point where she had this website. She has paid for it twice. So
Exactly.
So now someone is telling her, dump everything you paid for twice, and now go to somebody else that's going to charge you times 3 of what you are just paying for. And it was now my duty to tell her that this is the next move. And in as much as it was a bit reluctant, and this is why the definition of expensive is very, very relative. And I can tell you, and this is like, I cannot tell you what this woman has done in the space of that meeting. I think this was end of 2019, 2020. To where she is at the moment, it has gone, I don't know how many X. And this is because she chose right. And it doesn't have to be Tedbree. It's just the best solution for you that you need to go from one to the next level. You don't just, and it's not about listening to these people that are in that level that you are about to move on. You need to listen to the people that are in that next level that you want to get to, so that they can give you the right solution to go to that next level. So just thought I should share that, because it was funny when you were saying it brought back memories. So to you, Timina, please.
All right. So thank you so much, and I particularly like the fact that Ronke was vulnerable enough to share her own story in the light of everything that we're talking about. The most important thing to bear in mind is this: is whoever doesn't leverage on technology runs the risk of being left behind. The moment you don't do that, the world will move past you, and so you cannot afford to stay stuck at that level. And for me, really, it also has to do with the individual's perspective and orientation of technology. So for some business owners, when you say technology, they are thinking immediately about building an app or having a grant and all of those sort of things. But just as Cliff had said, and as Ronke has said, it's important to start from the basics, build gradually, start from where you are. There are free tools that you can use. There are things that are readily accessible. that you can begin to use and build from. And you would notice that as you utilize them a lot more, you would grow in that particular light. But what we cannot afford to do is to neglect tech and to assume that it's expensive. If you do that, you run a huge risk of being left behind in the dust.
Absolutely, absolutely. So I'm just going to, we have run over time. We are 4 minutes over the specified time, but I wanted each one of our guests, because they've taken, these are very, very busy people, and you guys, you should be extremely, extremely happy that they've taken time out of their very, very busy time to be with us today. So I just wanted to hear a closing remark for them. 30 seconds, please, guys. 30 seconds each. And on just, on the topic that we've discussed today and the future that you're seeing, and just any advice you're going to have for anybody out there that is trying to go into the health sector or trying to do something within the health sector and is feeling overwhelmed. So whoever wants to have the floor, you've got 30 seconds.
Okay, so this is what I would like to say. If you're in the health sector, you're feeling overwhelmed, trust me, it's very natural. It's very, very normal. I feel that way sometimes. But when that time comes, what you need to do is draw back, go for a reset, rest. Very important. People that are in the health sector, that's the one thing we don't do. We don't like to rest. We take on the weight of the world, forgetting that if we are not okay, we cannot take care of other people. So if you're feeling overwhelmed, that means it is time for you to draw back and revitalize yourself. And in light of what we are talking about today, the impact of technology in the wellness industry, just like Timileyin said, if you are not going to leverage on technology, you're going to be left behind, and people need us.
Thank you. Thank you for doing that swiftly as well. Cliff, over to you, please.
For me, it's a very simple one. It is just to kiss the problem, keep it simple, and see what technology, be it free technology, is out there that's going to help you to become a little bit more efficient. That will reduce the demand on yourself or on the project or on the business that you're currently within. So utilize technology to save you from stress.
Brilliant. Thanks for keeping that simple. And over to you, Timileyin.
All right. So thank you so much. So for me, what I really do believe is that we've talked a lot about the future, and the honest truth is that the future is here already. And we need to begin to embrace it as such. It's not 10, 20, 30 years down the line. It's already right here with us. And the sooner we begin to latch on that and leverage on that, the better it is for us. So for every single individual, both from the recipient point or from the producer standpoint, we must leverage on tech to be able to optimize and actually be able to leverage on it in such a way that everyone is better off in the end. So the future is not far off. It's right here with us, and we need to start doing something about it.
Absolutely. All right. So thank you so much to my guests today. You guys have been fantastic. The 1 hour just kind of flies by. Sometimes you think you could just keep chatting and chatting. And this was an interesting topic. I think we're definitely going to have to do a part 2 on this, because there are so many aspects of the health and wellness that we didn't even touch. We have the whole spa, we have the whole pampering side of things, and that we didn't even talk about. And health is a big issue. Wellness in itself is another tremendous issue with mental health and things like that. But I thoroughly enjoyed every single conversation that we had today. I enjoyed every single speaker. Thank you so much for being here. And for the audience, thank you so much for staying the whole 1 hour with us. And I am very happy to say that we are crowning Faith Adeola. She didn't leave her throne. She was there all through. So she was the queen at the end of this. And we'll be reaching out to you on how you get your 50 pounds. So guys, until next time, we're going to be bringing in some amazing guests again. And we're going to be tackling another issue that technology would help us in advance. It could be health, it could be something else. But just watch the space. And I'm Tommy Edwards. And if you are confused by anything that you've heard today, you need help, you need guidance on how to impact technology in anything you're doing, then speak to us at Tedbree. Consultations are free. Take it while it's free right now. And speak to us at Tedbree, and we'll be able to guide you in the right direction. Until next time, have a very, very good evening and see you guys soon. Bye.